This week I'm going to talk about gastroesophageal reflux disease, commonly known as GERD. This is a result of reflux of gastric contents into the esophagus. So it is a poorly functioning esophagogastric junction that includes the anti-reflux barrier composed of the lower esophageal sphincter and the crural diaphragm, coupled with the impaired esophageal clearance and alterations in the esophageal mucosal integrity. Reflux esophagitis develops when the reflux gastric juices triggers the release of cytokines and chemokines that attract inflammatory cells. Reflux commonly occurs in most people on a routinely basis. There's equal evidence of it in men and women, usually of an older age, but children can also be affected. A couple of long-term complications of GERD are esophagitis and bare esophagus. The etiology is a poor diet consisting of things such as fast food, soft drinks, coffee, wine, also antidepressants, aspirin, and other NSAIDs, positioning such as right side lying or sitting, increased intra-abdominal pressure, and then pregnancy in the third trimester. Some signs and symptoms include heartburn, usually 30 to 60 minutes after a large meal with either alcohol or spicy foods, nausea, vomiting, dysphagia, chest pain can also be symptoms, and then lying down may worsen the symptoms. To diagnose, usually those symptoms are a good starting point, but we can also do an endoscopy or reflux monitoring. Treatment includes some type of medication such as antacids, H2 blockers, and PPIs, which stand for proton pump inhibitors. Some side effects for the medications include diarrhea and constipation. And for the PPIs, if prolonged use could cause osteoporosis. And then if condition is very severe, anti-reflux surgery may be needed. And then some PT implications, so just telling them to avoid those aggravating foods, maybe making a food diary to remember what foods exacerbated their symptoms. Eating more frequently and smaller meals also helps, and to not smoke or not consume any alcohol. And then also suggesting that they elevate their head before bedtime and avoid meals near bedtime, so having that last meal about 3 hours before they go to sleep. And then if obese, just trying to lose some weight.